Chief Executive John Lee said today the government will review the public sector medical service system. Sources say that could mean increases in hospital fees and medication charges. As for the accident and emergency service charges at public hospitals, the fees could become higher or lower, depending on how serious the patient's condition is. Lee's comment came after Financial Secretary Paul Chan said on Sunday that a review of public service fees may be needed. Mimo Singhai reports.
The waiting time at some accident and emergency departments in public hospitals this afternoon was over 8 hours. The triage system at A&E departments divide patients into 5 categories based on their clinical condition: critical, emergency, urgent, semi-urgent, and non-urgent. Speaking ahead of today's Executive Council meeting, Chief Executive John Lee said authorities will review the public sector medical service system and the bills of A&E services will be targeted.
For the most urgent group that require immediate attention, they are Group 1. In terms of proper use of our A&E services, we should focus on those who are most urgently in need. In our triage system and according to past track record, we've seen that those who do not need A&E services have been using our services, so we should review our A&E services.
Sources say authorities are reviewing the entire public hospital fee system, including increasing A&E service fees to ensure medical resources are used appropriately and to boost government revenue. However, the sources say the increased A&E fees are aimed at semi-urgent and non-urgent patients. The current A&E fee is $180 per attendance, last adjusted in 2017. This woman thinks a price adjustment will add to the financial burden of grassroots family, but she thinks a slight increase is acceptable. Lawmaker David Tam believes adjusting the A&E costs for patients according to their condition can improve the system.
You must use other means to encourage people to go elsewhere if they are really not in an urgent situation. And fee structure is certainly one. If someone who has, say, a runny nose condition for a long time, but it seems to be getting worse today, if that particular person goes to an A&E, he will be told that you have to pay a fairly bigger amount of consultation fee, but he has, of course, a choice to go elsewhere.
News 9, TVB News.